welcome to the Doctor's Lounge, where scalpels meet systems. And the people who live inside the OR call out what's broken outside of it. This is where elite physicians and insiders say what they really think, as if I need that, about politics, policy, and the future of healthcare. All right, let's meet the crew. Dr. Coca, how are you?
I'm doing
What's
good,
going
Dutch.
on?
Thanks for organizing this. I've been looking forward to this for a while. I'm a private practice cardiologist in Philadelphia, and I've been interested in health policy for a long time, ever since it became obvious as a private practice guy that policy influences what you do in the exam room a heck of a lot. So I'm really looking forward to talking to some super smart people here about healthcare policy, what's going on in the world today, and happy to have you quarterbacking it.
Hey, look, we'll get a latecomer. And he's still in his scrubs. Hey, Doc, you want to just quickly introduce yourself? Don't do anything too fancy, though.
Sure. Senate Dixit, neurosurgeon. Know a bunch of the other guys on here. Dutch, you and I have known each other for a little bit. It's just great to be able to sit down, hang out, and chat about this stuff.
Amen. All right, Dr. Choi.
Great. Dutch, thanks for having me on. Dan Choi, orthopedic spinal surgeon in Long Island, New York. I've been pretty active on social media. Actually, I guess my claim to fame is I had the first Instagram account revolving around spine surgery back in 2017. I also pretty active on Twitter, now X, and I've also been very involved in advocacy work. So I own and operate my own 3-physician orthopedic spinal surgery group in Long Island. But also what I've realized is that you can't keep a practice sustainable if the laws are not in your favor. So I got involved in lobbying back in 2019. I met a lot of you online because of the work we were doing on trying to advocate for certain laws like No Surprises Act. And just recently, actually, what was exciting is just tweeting or writing X posts about policy led to Elon Musk reposting something I wrote about the Affordable Care Act.
Hey, man, that's one of the things we were going to talk about later.
All right.
I mean, you just took the gift away.
No, I'm going to open it
All
up
right,
with a bang.
last but not least, the guy on the West Coast killing it.
Thanks,
What do you
Doc.
got, Doc?
Yeah, Anthony
Oh, so
DiGiorgio.
good to see you.
I'm a neurosurgeon out at UCSF. I work at our Safety Net Hospital treating neurotrauma at San Francisco General Hospital. And I have an interest in health policy. Part of our Institute of Health Policy Studies here at UCSF, I can bring you the perspective from the ivory tower out here in one of those august institutions.
Yeah, I have yet to do one of those wonderful nonprofit articles about UCSF. I think I'll hold off as long as you're on the pod. I
We
think
appreciate
that'd be
that.
a wise decision. I haven't done UAB either. So that's a little close to Dixit. So I'm trying to hold off. What I wanted to ask was, look, what was the reason that the 5 of us kind of decided? I think I sent this email to you guys randomly, maybe a month and a half ago or something. And I respect you guys deeply, right? Like, we all met online. I met Sanat first. We met at some ortho forum meeting, I think in 16 or 17.
19, actually.
Oh, was it 19?
Right before COVID, yeah.
Yeah. Yeah. So we got to do that. And then I met Dan not long ago. And then I got to meet Anthony in person, but I've not met Anish in person. So I got to make that happen. Because I went to see a friend of mine, Dr. Liss. I think you talked to him, Dr. Coca. I went to see him in Philly. Anyways, so let's just talk just for 2 seconds. Tell me why you wanted to do the podcast. You know, this is supposed to be comfortable. We're in the Doctor's Lounge, as you guys call it. And why are we doing this? What are we doing this for? Go ahead. You start us off, West Coast.
Yeah, I think most of the healthcare podcasts that are out there tend to lean one direction. And I think the 5 of us really have more pragmatic ideas about how to fix the system. We're really focused on things like autonomy, independence, patient personal responsibility. Some of those ideals that I don't really see out there a lot in mainstream conversations. So I think we all share a deep foundation. We share kind of first principles. And honestly, for me, I'm a little bit of a fanboy here. Dutch, Dan, Anish, I've been watching your guys' stuff forever since I was, I think, in residency. So the chance to be on this podcast with you guys is something I couldn't turn down.
It really kind of is that way with Anish, isn't it? Because he was like the first guy I ever saw. I'm like, that guy's a serial poster. What's he doing? This is amazing. Yeah, you were first.
Yeah, absolutely.
And he had a podcast.
2017
do it?
to 2021. So 4 years. It was a great time. Really good. It was Dr. Michel Akkad, the famous Michel Akkad. He's out on the West Coast by
Yes.
Dr. DiGiorgio, Anthony. And we were writing a lot and we were podcasts were just getting started. And we thought, man, we want to try to get the word out. Have you guys heard of the Tuttle twins? You guys not?
Yeah, I have their
Yes.
books.
My kid was reading The Inflation
Yeah,
Monster
I mean,
the
it
other
is an
day.
incredibly intelligent cartoon that's geared towards children,
Yeah.
right? Dan, this is a must watch for your kids. And this is a cartoon that
Yeah.
has Milton Friedman shows up, right?
Yeah.
Today they had
Yeah.
Bitcoin, today
Yeah.
I was talking about Bitcoin, or kid was watching today was on Bitcoin. But the point is that there is this massive amount of, as Anthony alludes to, there's a massive amount of information that kind of shades everything one way, that frames everything in a certain color so that medical students and the public think that there are certain things that are settled, right? That are settled matters. And that's the whole point I started writing in 2014, 2015. That's the whole point we started the podcast in 2017, is that, what? Once you get on the ground, once you're on the actual coal face, it becomes really obvious that there's a huge disconnect between everything that's coming out and the perspectives of the New England Journal, things that are coming out of academia, and reality. And so it's really important to get that message out there from practicing physicians about what the reality is. And yeah, Tuttle Twins is a cartoon that is really pushing back against a bunch of different things, introducing kids to ideas, to different ideas that aren't in the mainstream.
Does anybody else have this for their kids?
Yeah. Oh yeah. I got the books. I didn't
you
even
have-
realize it was
It's
a
it's
TV
a cartoon.
version.
It's great.
My daughter loves the books. The Food Truck Fiasco. She's reading that one right now.
I'm gonna order it
Yeah,
after this.
yeah. So you want to hear
Yes,
about
it
like how
sounds great.
They even have a
if you
toddler
want to hear
version.
about how regulations, we should probably invite Tuttle Twins. We should probably do a Tuttle Twins thing. Yeah,
Read the
exactly.
Tuttle Twins
Yeah.
as a pod.
But yeah,
That
about
would be a
why
good-
regulations
really
are
good
bad,
idea.
why protectionism is bad, why a variety of different things. It has its own free market ethos, and that's why it's so important that we keep trying as physicians to try to get that message out. Because if you don't get that message out, there's just so little that is directionally in a manner that's closer to real truth. And I think there's a whole bunch of folks that are out there in the ecosystem that are trying to shape ground truth. And I think that's dangerous. I think it's bad for patients. It's bad for physicians. And we need to try to get that message out. So that's why I think it's like this are just so important. And the more folks you can get together, the brighter folks the more minds you can get together, I think the more effective you can be.
All right, who's next?
I think all four of us being on this call, the physicians, so not just rolled out of the OR, we're kind of putting up our social media posts and our X posts and our thoughts. And I think it's important to obviously, if you have all these ideas in your mind on how to fix healthcare, and a lot of physicians have ideas on how to fix healthcare because they're living the nightmare every single day trying to take care of the patients in this upside down system right now we have in America. If you don't get those ideas out, it doesn't really matter, right? Nobody hears about it. No one's going to act upon it. And I think that we are in this window right now, this incredible window where there could be some major shifts, structural shifts in the way healthcare is delivered and administered in America. And so this is why I think the four practicing physicians, even though we really don't have time, we're taking care of patients all the time. We have young kids, some of us, we're like, look, it's important to get our ideas out in a systematic fashion. Like all of us kind of X post in between cases, and maybe late at night when I'm doom scrolling, I'm like, oh, and I read something that really pisses me off about Affordable Care Act, and then I decide to talk about how I regretted voting for a certain president when Affordable Care Act was posted. I was posting recently since the Trump election. I was trying my best to tag RFK, Elon Musk, because I knew this is like a window. I was like, they're never going to hear me. And I think I posted probably 100 X posts on my own ideas. I was like, this is the chance. If anyone's going to take this and run with it, it's going to be now, because the physicians here, we've lived what it's like to be under systemic. You can't fight an uphill battle for too long. Like the laws are what dictate the healthcare environment in America. So if we can't change that regulatory or legal environment, we're always going to be fighting an uphill battle in terms of healthcare systemic change. So I think this is the time to strike while the iron is hot and deliver our message and talk about our great ideas.
Couple thoughts. Dr. Dixit, do you have a certificate of need in Huntsville?
Alabama, yeah, we do.
Oh, you do? Yeah. You guys are totally controlled by BCBS of Alabama, aren't you?
We
I
are
read
pretty
somewhere
much.
they had like 98%
Yeah,
market
yeah,
share.
Yeah, 90%. Now, the funny thing is, we actually follow CON, our group, and we did it without the hospital. We did it on our own. And there was some doubt that we could do that. But the climate is certainly changing, but some of these things are still very much entrenched. But in the past couple of years, a lot of those CON states, they've been kind of changing their regulations. So if there's a time to strike, to do some of the things that we're passionate about doing, it's now. And that's another reason why I think this venue, this format is so valuable. I was going to put my 2 cents in following up with what Dan Nish and Anthony said is we're here because we are passionate about the field of medicine. We love the field. There's something about patient care that really resonates with us. And I think most of us will agree our patients reflect that back on us. They trust us. They want us to succeed. And we want to make sure that things are great for our profession, great for our partners and colleagues, because it's a great job. It's a truly noble thing to try to do. And we all see what's happening to it, and we don't want to see any of those bad things happen. We want this to remain a noble profession, but there's certain things. There's got to be a sea change to basically enable that. And that's what's great about what Dutch advocates for. He advocates for ownership, being very proactive, being very creative, and it's something we can all get behind, something we're all very passionate about. And hopefully we can make that sentiment a little bit more infectious.
Sure. Anthony, I'd love to hear your thoughts.
Yeah,
There-
I agree with everyone. And Dan's point about that former president, I think you ratioed that former president after Elon retweeted your post, which it tells me this groundswell out there. And I think, Dutch, we were talking earlier offline that I get people coming up to me at some conferences saying, I'm so glad you're able to say what you say. And I think there is this, I don't know if you want to use the silent majority type mindset out there, that there are a lot of people that agree with us. They see the holes in the system. They see how Medicare and Medicaid are not working for patients. They see how physicians have had their autonomy stripped, and they want some voices to speak out for that. And I think, again, the 4 of us, 5 of us agree on sort of what a lot of the underlying problems are. And I think we actually there's some positive things coming out of it. I think we actually have some solutions. We're not just complaining about certificate of need laws. We're actually going out there and doing things to help overturn some and fix some of the problems that we see in the healthcare system that don't involve just more government control, more central planning, more bureaucracy. So I think I like the pragmatic solutions that come out of everyone here.
So since you're talking now, I'd love to ask, I think we ought to start with healthcare and politics. And so what are like a couple things, maybe 2 or 3, I don't want to pigeonhole you. What are a couple things you think the Trump administration specifically, whether it's Dr. Marty Makary, it's Dr. Oz, like, what do you think are 2 or 3 things they can do structurally that will benefit patients and physician-led
First of
work?
all, it is so incredible how different 180-degree direction that we are on in so many different spheres. Medicine isn't immune from that, of course, is really incredible. The Trump effect is just astounding. Today, Vinay Prasad was named head of CBER, the Center for Biologics, controls approval related to biologic drugs and stuff. That is and he replaced Peter Marks. And Peter Marks had a completely different kind of approach to all of this. So whether you agree with these folks or not, I think there's little question that there is an opportunity here to take things in a direction that's very different than prior Republican, prior Democrat institutions. I think this idea of the managerial bureaucratic state really running everything and the president was just a figurehead, it was really salient and probably very close to the truth. And Republican or Democrat coming in, what does he know about biologics and whether or not approval should happen? So you just let the bureaucracy kind of decide who is going to do that. And it turns out to be this really incestuous kind of group of folks. And then you combine that with establishment media platforms that simply amplify everything that these folks are saying, and you just don't get anything at all that's different. So I think with Oz, who's a former cardiothoracic surgeon, is head of CMS, you have Makary, head of FDA, and Jay Bhattacharya, head of NIH, and Vinay Prasad.
And by the way, who of you, because I think it's all of you, do you guys know all these guys personally? Have you met them all?
Not Jay.
Who knows Makary? Yeah, you know Marty.
Yeah.
And then Dr. Oz?
Yeah,
Yes, no, maybe
Oz is
so.
too
I
famous
can't
for
Never
any of
met
us.
him.
Never met him, no.
Okay.
I believe his brother-in-law is a neurosurgeon, though.
Okay.
So 1 degree
Yeah.
of separation.
By the way, not only was he a surgeon, but he got his MBA at the same time, which just
Yeah.
shows you that MBAs aren't that hard to earn.
Yeah,
I don't
I've
know, like,
got one. I've got one. Anybody can
I
get
know, they're easy. That's why you got one, because it was like a weekend deal. You were like, 24 hours, Harvard, whatever. Easy.
No, but it's
Anyways,
interesting what Anish said
Yeah.
here. You've seen a real culture change in that community. These are a lot of political appointments, and just like becoming a chief medical officer for a hospital, It's not a clinical appointment, it's a political appointment. And it's refreshing to see that these are political appointees, but first and foremost, they were selected because they had a different train of thought. They had a different approach to things. They were, I won't say disruptive, but they were just out of the box thinkers. They were actually scientific method as you ask questions. And the culture for past 48 years is don't ask any questions, don't question authority. And unless that's Galileo would have a real problem. But it's refreshing that we have those folks in there. Getting Jay Bhattacharya in there, that was like the ultimate vindication because I don't know which one of you signed the Great Barrington Declaration. I don't know if any of you read it, participated, signed it. I'm like, finally, this is like somebody's trying to make sense of this. And this is when I was still kind of, let's get the jab. It's like you've got people using scientific method to like from science, which thank God. And I mean,
So the good news
that's what
is
we're
you have a
quite
group,
a
I
while.
think, that is very different than the standard folks that every time there's zero new ideas. Every idea is sourced from like the perspectives page in the New England Journal. I'm sure 100 years from now is going to be looked at. This is like the tabloids or the Inquirer level type stuff. That's really bad. I don't want to say bad news, but kind of the uphill climb for them is really the popular perception of a lot of things in healthcare, which is why I love all of your posts so much, right? Because it's much closer to the truth. And it's like trying to educate folks because everything, the laws, regulations, all of it is downstream from culture, right? And so how do you change that cultural milieu? And that's part of what we need to try to help do. Because if the moment you try to say setting the price of drugs is bad for X, Y, and Z reasons, right? You're going to run into all sorts of stuff saying that, hey, this is bad because you just want to let people die if they can't get their drug. The moment you say we need to go after academic health systems, when a regional hospital system that's surrounded by 6 other hospital systems within a 2-mile radius shuts down, it's like, oh my God, like everyone's going to die without this regional hospital system. And, so man, it is really hard. But I think I'm curious to hear like what, I mean,
I'd love to hear
we've
from
talked
you
a lot
guys.
about, we've talked about site neutral payment. We talked about 340B payment reform. We've talked about drug acquisition and going wholesale versus all the middlemen that we have and PBM reform and stuff. But I'd love to hear from the group in terms of, we all have very different perspectives in terms of where we sit. But what do you think is, what's the highest yield thing of those things? I'm not entirely sure. And what's politically practical as well?
Yeah. Well, Dan, I know that you actually got on X and you were pretty boisterous about what you were thinking and what you were doing.
Mhm.
Like, what do you think of the new administration? Do we have a chance? Do we genuinely have a chance to change things?
I'm pretty cynical of American democracy. And I think it's because of my firsthand experiences looking at how the sausage is made. And I think you get a behind the scenes
Yep.
look if you're involved in trying to shape legislation. Because, right, legislation is
Yep.
the democratic part where everyone's supposed to participate, put their ideas in with their House of Representative rep or their senator of their state. And the deeper you get into it, the more you realize it's just not the case in American democracy. And yeah, sure, Trump may turn the whole system on its head, but I do also think democratic process is pretty corrupted in this country, unfortunately. And this is why you see special interests so entrenched, why you've seen healthcare get completely consolidated in America, run by corporate medicine. You have on the insurer side, you got United, Cigna, the Bucas running the show, highly consolidated marketplaces that they dominate. Then on the healthcare delivery side, you've got United Healthcare owning Optum. You've got all the health systems just dominating healthcare, and then you got the physicians just completely crushed, right? Individual practices, private practices no longer in existence. And I think that was all planned by design with the Affordable Care Act. And I talk a lot about the Affordable Care Act, or I just kind of rage against it on social media, because I think that was the linchpin where it all came crashing down, where the flaws of American democracy, where you allow special interests to come in and basically write laws. I don't think Nancy Pelosi even her staff had not read every single page of the Affordable Care Act before it passed, and she admitted it. And even myself, when I was trying to lobby for the No Surprises Act, and I went to DC, I actually took the Amtrak down from Long Island. I went and met with I remember that day very vividly. I met with 2 legislators here in Manhattan, trying to talk to them about how the No Surprises Act was going down the wrong way because it was going to get passed the way the insurers wanted it. Then I took an Amtrak train down to DC, And I went from meeting to meeting that our specialty society had set up. And I had been trying for 2 months to get a meeting with Lee Zeldin's office. I had emailed and cold called. No one was doing it for me. I'd emailed myself begging
Yep.
for a meeting because I take care of his patients I take care of your constituents. So I would think you would want to hear from a doctor. No response, totally ghosted until I walked into his brownstone fundraiser at 5 p.m. with a $500 check. And I walk in, and I'm literally the only citizen, the only constituent. And everyone else in that brownstone who's there for that 5 p.m. fundraiser is from Bank of America, American Airlines. They're all corporate guns. They're hired. They're lobbyists. I was literally the only constituent. I was a unicorn. People were staring at me like, who are you? I'm like, oh, I'm a physician in your district. I take care of your patients. I'd like to tell you about legislation that's coming down the pike it's really bad for your constituents. It may close down my office. I might not be able to take care of it. I might not be able to take call in the hospital in your district. And it was kind of like, he obviously heard me out, but I looked around and I was like, how am I the only constituent here in this room when this is a democracy? And I started to see how the sausage is made. And the way it works now with PACs and super PACs, it's an arms race for fundraising, right? Whoever can raise the most money gets their ideas heard first and foremost. Not the best ideas, it's the people who are the most financially resourced and who can play that game. And I think physicians, historically, we are way too busy taking care of patients, saving lives, to be super politically active. And this is where we faltered. And unfortunately, our patients have also suffered because of it. And so my overall thing, I'm pessimistic. I'm a fan of a lot of what the Trump administration is doing. They're making necessary changes, but I have a very healthy, I think, pessimism that structural change. I think right now United Healthcare is all in there. They know the people that they've got to talk to, and all the corporate guys, they know who to talk to, and they're going to pull the levers and somehow sway the conversation, saying, "Hey, the status quo, the devil you know, is better than the devil you don't," something along those lines. And we're going to get stuck. That's what I think.
Who else has spent time in DC and has had a similar experience?
I'm the only one, I guess.
Yeah, I think so.
Yeah.
I mean, I've spent some
So
time.
just Dan and I?
I've spent a
I mean,
little
I
time
know,
in
'cause I thought
DC,
the
but
lesson-
it's.
Yeah.
I got to actually spend a month on the other side with Senator Cassidy when I was a resident.
Yeah.
He invited me up, and so I got to see a little bit behind the scenes. It was a great look. First of all, I garnered a whole ton of respect for Senator Cassidy. That guy knows healthcare policy in and out. Incredibly high energy, very much on the doctor's side. But you see those meetings after meetings. And Dan, I'm not quite as pessimistic as you. I think a lot of that is driven by money, but the politicians have the ability to say no, or the ability to say, yeah, you wrote me a check, but I'm still going to do what's right. And a lot of interest groups, I think, do punch above their fiscal weight. And I think physicians are one of them. You're involved with the AMA, what the AMA is capable of. We can probably have a whole episode on what's happened to the AMA and its direction. But physicians do tend to punch above our weights. Patient advocacy groups certainly do. How much they're funded by interest groups or a front for interest groups, I think, is to be debated. But yeah, I think that seeing behind the scenes made me realize it's not just who can write the biggest check. And again, it totally depends on the politician. And what's the old saying is that you get the government you voted for. So if anyone's to blame, it's us for voting these guys in office, guys and girls in office who respond to this fundraising and all that. So I'm not quite as pessimistic as you. I think the latest couple rounds of populist upswell, despite every institution being against the populist candidate, has shown us that there is a little bit of room for democracy to work.
What do you think, since you're on the West Coast, I have to ask you this. You're around the Maha moms. What's the overall sentiment of RFK?
The Maha moms on the West Coast. Nobody out here likes RFK. It's ironic because I live in Marin County, which prior to COVID had one of the lowest vaccination rates in the country. It was the hub of the far left anti-vax movement. Because remember, that used to be a staple of the far left.
Humongous.
Yeah. So it's ironic that now it's one of those phenomenon that if Trump says something, the other side instinctively goes against it. The classic example was when he was for school opening, and then all of a sudden, American Academy of Pediatrics came out and said we should keep schools closed. So it's been classic 180-degree shift out here towards pro-vax ever since Trump and RFK came out. And I wouldn't even call them anti-vax. I think they still promote vaccines. They just want to, I think, look a little bit closer, which is especially understandable after what happened with RNA COVID shots being forced down our throats.
What's the sentiment around RFK sans the vaccines? Like, do we think at all from your perspective, do we think at all that he might be effective as the leader of HHS? That's still a question for you. Oh, look, there goes Dr.
Go ahead.
Yeah, that's fine.
I know. I think he certainly has a kind of the bully pulpit, if you will, and I hope that he makes some good decisions in terms of who he is appointing. He's a trial lawyer, obviously, and so he needs help. So I think the folks that are at least closer to healthcare and healthcare policy, whether it be Vinay, Marty, or Jay, those folks, I think there's an agenda that he has, and I think that helping him get that agenda properly formed so that everything doesn't just get dismissed out of hand is going to be super important. So I'm optimistic. If you're surrounded with people that are reasonably good, then I think we're going to come out with hopefully something good. The question is, he's of course fighting against a constant wave of everything he does is the worst thing ever, right? It's the Trump, it's the TDS,
Yeah.
it's the RDS, whatever that people have.
I think it's interesting seeing who he did surround himself with. I like the Dr. Oz pick. And from what I've heard is he's given a lot of deference. I don't think RFK really has a strong sentiment on the issues that we're specifically concerned about, how CMS runs, for example. And so I think he is, exactly. And having Oz there gives RFK someone who's really strong that he can defer to on a lot of those.
It's so weird to see the left line up against
Well, I know a
RFK,
bunch of
right? It's insane. The guy is very like all natural. I don't like medicines. I don't like vaccines. I don't like this. Meaning he has that ethos that everything needs to be like, if we just ate better. I feel like his sense of medicine is that all of us are doing work that is somewhat unnecessary because the American people are being poisoned, if you will, or whether that be on their own agency or not.
Yeah.
But yeah, so interesting.
Dr. Dixon, any thoughts? I'd love to hear from you.
I'm going to wait and see. There are things about RFK I like. He is an attorney, and just the background that I've gotten on him is whenever he's invested time in something, he tries to understand that to a degree of granularity that's actually impressive. I'm going to wait and see what he does. Part of this is that he's captured a cultural zeitgeist with a certain element of the right, which is predisposed to a knee-jerk reaction on the left. We'll see where this goes. I will tell you, if you benchmark him against the last guys, Becerra was an environmental attorney. He had no healthcare experience in general. And it was just one of those, it seemed to be HHS secretary was like one of those stepping stone things at these political appointees when they want to climb the political rungs. That's what happened with Sibelius. That person was basically towing the line.
I think the
for
important thing to
somebody
look
else.
for is are these folks going to be presented with new data points, and revisit some positions that they have because of ideology, right? Everyone has ideology. Everyone has bias, right? I think the thing that's always impressed me about Vinay Prasad, for instance, is that he's not just, he's got a certain ideology. Yes, he has a certain bias, but if you present to him different data points saying, hey, these things may not be great, he takes off that tribal hat right away. So that's the question. And with RFK, I think there's some, like the MMR vaccine, his comments there, he's clearly shifted significant ways away from what he was saying, or what at least was being said in 2019 with the MMR vaccine and stuff.
Right.
He's saying, look, the MMR vaccine is safe, it is effective, it is a way of preventing your child from getting measles. But, and this is where people lose their minds still, is that it is not necessary. You don't have to do it if you don't want to. We want to give parents that ability to not do it if they don't want to, or if they have concerns about it. And we need to study these things more. And that last part, they lose their mind about, forgetting about the fact that he's clearly, someone has talked to him, or he's been presented with data, or maybe the Samoan outbreak in 2019 convinced him otherwise. But he's clearly of the opinion now that the MMR vaccine does work and does prevent measles, mumps, rubella. I think that to me is a signal that he's going to hopefully be effective. I think, and to the point that people make all the time, I mean, look, I think that all these folks are significant upgrades from what we had before. Peter Marks, whether it be Oz, any of these folks, I think they're all massive upgrades from the Andy Slavitt era of things.
Why do you think that the physician community at large was pretty hard on Becerra? I think rightfully so. But we're 115 days in. Well, actually 108 days in. And why do you think people aren't giving them a chance? Why do you think the complaining's already started? Or is that just a normal symptom of a wonderful democracy?
I think that just, one point I wanted to make about the previous question about RFK is that I think and this actually ties into Becerra, is that I think that one of the things I hope that this current administration looks at and thinks about is really actually valuing and wondering what physicians think about healthcare. Because previous administrations, government officials in general, I think tend to see physicians as not just an afterthought, but a nuisance, right? Because central planning of healthcare, what you've got to do to be able to effectively centrally control is you have to control physicians. That's what the Affordable Care Act was all about. It was about how can you get rid of all the independent doctors in America, be able to wield your influence over them. And you can wield a lot of influence by having just a few hospital systems control and employ all the physicians in this country. And guess what? You don't have to hear them out. You don't need to listen to all of them. Just like Governor Cuomo didn't want to listen to physicians when we said it's a bad idea to discharge COVID patients into nursing homes. No care, didn't want to hear from us. Same thing. Look, we're on the ground floor. We know what happens on a day-to-day basis. We know and watch and see our patients suffering. Then we see them suffer, not just from their sickness or their pathology and the emotional pain from dealing with their sickness. We see the uphill climb they face from the financial toll and the burdens they face from this healthcare delivery system that is not working for them. And we see it on a day-to-day basis. And on a microcosm level, in my little private practice, I can fix it. I can address it, and I can try to make it better for my patients. But systemically, why you see healthcare so broken, in my opinion, is that previous administrators, previous legislators, previous administrations have just said, you know what they'll do is they'll go to the official voice of physicians, which is the AMA, American Medical Association, which is why I've chosen to engage with the AMA to try to shape that voice, right? But they just take one voice and then game over. That's all they want to hear from. What I'm worried about with RFK, because they've already targeted the AMA, right? They've already said, we're going to get rid of CPT codes and we're going to get rid of them. Where are you going to get your physician input from? And I hope it's a good, reliable source of practicing physicians that you're going to hear from. First of all, are you going to value that opinion? And secondly, are you going to go and obtain it? Because look, we see what happens every day in our healthcare system, and RFK just all of a sudden going, look, Maha is going to fix everything and we're going to cure American sickness by diet. That's not going to happen overnight. It's going to make some kind of impact. We're still going to have heart attacks. We're still going to have strokes. We're going to still have really sick people in our hospitals. And you have to fix that broken system. And you have to hear from physicians to do it effectively.
What do you think, and the group two, what are some metrics, say 300 days in, say a year in, say a year and a half in, that would make you feel like these folks are listening? Is it the fact that is taking away the physician, the fee schedule, the cut that's currently there, I forget, some 2.8%. And of course, the salt in the wound is that the Medicare Advantage plans got a payment increase and the hospital. Exactly. So yeah, what are the metrics that we need to hold these folks?
I think it's a great
looking
question.
for, like, again, how do we hold these folks accountable?
Anthony, what do you think?
I'm always skeptical of metrics, and the old Goodhart's law pops into play. We know about that. I'm happy that there's physicians in leadership, Oz, Bhattacharya, et cetera, looking on down. I'm happy that there's physicians in leadership. I mean, overall metrics, I think the things that we really want are bigger than things that can be tracked with metrics, right? I think if you're talking about rolling back the ACA, rolling back the consolidation of healthcare, that's not something that's going to happen instantaneously. And it's going to be tough to measure. But sure, we can measure the HHI of major consolidated systems and see a multi-pronged attack on healthcare consolidation. I would love to see that. I don't know that it's going to happen in the first couple 100 days, the first couple of years even. That's going to take a while to undo this 2 decades of consolidation we've had.
Here's my question for you, though, for all of you is like, but why? I mean, I want to be up CMS's rear end going like, hey, what are you guys doing? I know a bunch of the Republicans like Medicare Advantage. I know they do. And I do like parts of it. I know we've had these conversations on X that, we all differ on this, but there are parts of it that I do like. But my point is, why are we taking it up the rear end from CMS if MA plans are getting an increase and facility fees are going up, but pro fees have continued to go down, at least the last 5 years? I think we had a break 2 years before that. And then the 16 or 14 years before that, it was all decreases. Like, why can't we fix that in the next 30, 60 days? Like, why?
But the main thing is, the original sin, even going back further than what Dan's pointing about with ACA, I think the original sin was Medicare itself, the government becoming a plan operator, right? Once the government operates a healthcare plan, it can't respond to price signals. It invites rent seeking. And that's all we've seen since Medicare has come out. You want to control doctors, control how much they get paid, and then use central planning to do that. You want to control the AMA, sign a contract where you're purchasing CPT codes for a whole bunch of money from AMA. And then you really have some leverage over the AMA, right? That was our original sin. So I think in order to walk back from that, to take CMS from being a plan operator to solely being a plan regulator, that's going to be a massive lift. I don't think that's capable with just regulation. I think
What I love about what you just said is this is a teaching moment for the American people, right? Like people are always asking, like, why is healthcare expensive? And I'm like, Medicare. They're like, what about Medicare? And I'm like, well, that it exists at all. Oh, you want to get rid of old people insurance? No, but that's not how it started. Have you read a book? Do you know how to use Google? They have Chat GPT now. You can figure it out. You just type it in. Right. So I think your comment's spot on. I know you want to say something, Dr. Dixit. I'm like trying to figure out what we're waiting. I'm like, just hurry up and say it already because I'm anxious to hear it.
I'm going to go off on a little bit of a tangent over here. I think to Anisha's point, maybe it's not going to be a metric in terms of the way we typically think about KPIs. For me, it's I want to see a win. And the easiest, lowest hanging fruit, something you're passionate about, is roll back the ban on physician-owned hospitals. That's concrete. That's simple. That's concrete. It's
Amen.
going to have a ripple effect. But there's another element to this. 70+% of us are employed now, either through a hospital system, private equity, or something. We're employed. We don't own the practices. So what's happening in medical school is these kids are not being taught about how to be independent operators. The assumption is you're going to be an employed physician. Why do you care if there's going to be a pay cut in Medicare if your hospital's going to pay you a salary anyway? You're desensitized to the policy initiative because you don't own anything. And the thing that you keep going after is we need to be owners, we need to be operators. That would be a concrete step. That would be a concrete win that a lot of us can align around. Because there's how many professional societies, and we all go to Washington and tell these people something completely different. While the hospital association, the insurers, the trial lawyers, they've got one voice, and we've got 200 scattered voices. We've got two different lobbying
Trying to
mechanisms.
fix hospital reimbursement first before we I mean, is that something that has to go in tandem? Because what is the major problem that we have with healthcare in terms of certainly the government's involvement in it is that healthcare is blowing a massive hole in the budget, right? I mean, these guys, the current administration is highly motivated, right? They got to find $1 trillion in savings a year. They've got to generate $1 trillion in revenue a year. So how politically feasible is it to be like, hey, I want physicians to own our hospital. Look, we all understand why that would be better. That'd be a better experience for patients. We'd be able to do things at lower costs and stuff. But how are we going to translate those costs over to, say, the government, the third-party payers? Meaning,
Because premiums would go down. Medicare
Yeah.
premiums would go down. I mean, if I had another 600 hospitals, because I see this, right? 'Cause
Competition.
this is
Yeah,
my
competition.
this is my piece.
Yeah.
Is we have so much interest from physicians around the country. I think, look, I've never seen a construction boom like I did in Phoenix and New York City in my early days. But you get rid of that ban tomorrow, and I'm telling you, 500 doctors line up at their stake going like, can
It's
I
a
open
win.
one?
Yeah.
Every single ortho, cardiologist, and neurosurgeon I know would say, yeah, sign me up. And by the
Right,
way,
that's
banks
what-
would lend the money.
I'm going to go work for Dan Choi.
Me too.
Yeah, right? Me too.
But that's because the reason that people would flow into the reason capital would chase that is because of where the prices are at the moment. And those facility fees are like, that's the end game, right? For private equity is those facility fees that you make when you sell the hospital or whatever.
But
how-
can I
it's
counter your
obvious.
point a little
Yeah.
bit there, Anish? There are physician-owned hospitals who don't
Yeah.
participate in Medicare. I know
Yes.
a couple neurosurgeons don't,
Right.
and they do very well because they can undercut the local conglomerates. They can sell to
Okay.
insurers for less than the local conglomerate does. So I think I agree with you. I think the facility fees are a problem, but if you induce that competition, you have an overall lowering.
How does that
of the
lower
price.
Medicare? How would that lower what Medicare is paying? Because Medicare's geographically varies, of course. But if Dan opens a hospital in New York City tomorrow next to Mount Sinai and Columbia and whatnot, is he not going to take? I mean, Medicare is going to pay him what? I mean, complexity patient and all that. I get it, but he's going to get paid pretty handsomely based on what Medicare pays in that geography, correct?
Yeah, no, I think
Oh, for sure.
you're right.
Maybe.
So
Yeah,
But
go
what
ahead.
he gets from MA will go down
Right.
because that's a private payer. They negotiate like private payers. So I think it would have an overall depressing effect on just the price in general. But you're right. The next step is Medicare.
If you really think about the kind of disparity I agree with Anthony. I think the original sin is that you allowed government to control pricing, right, in healthcare, right? When you have price controls, it leads to shortages. The government's picking winners, they're picking losers. And look at healthcare, right? Look at Medicare, the fee schedule. We talk about a total knee replacement, right? The total knee surgeon will get paid about $1,000, maybe less. Now I think it's like $800 for a total knee. And the facility, the hospital gets paid $25,000. Okay. So let's put that. So you get $1,000 here and then $25,000 to the facility for a total knee replacement. And what you've seen is that Medicare has continually cut the physician fee schedule year on year. It's like down 28% in the last 25 years. Our facility fees have taken this upward line up. And this is the original problem with price fixing, right? And Medicare, remember, for a physician fee schedule was at some point considered a safety net program, meaning that it is for like the indigent in our society, like those who can't take care of themselves and cannot provide for themselves. That's what we're paying. That's the fee schedule. That was not the market fee schedule. But all of a sudden they flipped it, and somehow the private insurers have convinced all the regulators and the government officials that Medicare professional fee schedule is the market rate and should be the market rate. And I know all the private practices are somehow trying to survive. And this is why private practice really can't exist in an in-network model today in America, because all the contracts are pegged to Medicare. And Medicare is not a sustainable fee schedule for physicians, especially in the setting where you've seen the hospital groups lobby for their fees to go up, and it's one pot of sum of money. It just has become so disparate. And I think that's what Anish is alluding to. And I think what they're trying to talk about with site neutral payments is that now you're bringing down the facility fee payment to that outpatient fee schedule, and that would bring some parity. But what you really have to do is relook at the Medicare fee schedule and ask, is this really a market-based payment for physician services? It's not. And so if physicians don't have access to market-based payments for their professional fees, they don't have the capital to build hospitals or build facilities or expand their healthcare delivery services, and you end up the same place. And so I think you have to look at the whole entire fee schedule structure and how it's become so imbalanced over time.
Oh, let me just mention one thing. Remember that health systems don't win just on Medicare facility fees. They win on lots of stuff that we talk about. Certainly we text about it or we X about it, right? Which is 340B money, GME money. Oh, by the way, I don't pay any property taxes. I don't pay any state taxes, and I don't pay any Fed taxes. Even if we got together and we were like, hey, we could build 300 hospitals tomorrow, we're still saving Medicare money. And we're still saving the federal government money, and we're still a net benefit to our city because we're going to pay property tax. And we're still a net benefit to our state because we're going to pay state taxes, and a lot of them. And we're still a net benefit to the federal government because now we have to pay for-profit tax. There's no way they ever let a physician-owned hospital be nonprofit. None exists today. None have ever. To my knowledge, I hope somebody comments, after we post it and says, no, Dutch, I'm sure there was one, in Wisconsin somewhere in 1918 or something like that, because I haven't heard of one. So I think it's important to remember there's so many advantages that these people have that if the one policy initiative we had, as Dr. Dixon said, was, yes, physicians could again own hospitals, I think we see a massive construction boom. I've seen a big tax base increase. And I do think it would, I don't want to say the phrase trickle down, but I do think premiums go down. I think if we allowed insurers, right, more insurance companies to exist, we could do it. I mean, that's part of the problem is we don't allow competitively because of policy. So I want you to answer, and then I got another question
it's such
for
a complex. Most hospitals that are physician-owned really should not be a network with Medicare. Like, why play their game? Oh, by the way, they've got an arcane set of rules that, my God, if you, honest mistake, do something wrong, right? Now suddenly you're in trouble as a contractor for the federal government. DOJ is going to come after you. But
yeah, DOJ is going to come after you. You don't want that.
You wonder if maybe we have the best. Maybe we should, I hope the physician-owned, forget about the whole Medicare thing. We should just stay out of network with the Medicare, because I don't know how exactly we can fix the Medicare fee schedule. It just seems a very tall order. I think it just is that a reasonable approach to be like, all right, Medicare is just getting more and more broken, and the best way is like, all right, we're going to set up all the stuff outside of the Medicare network, and that will eventually fix the system.
It stops working for people, right?
Today they think it's MA, and you guys don't want that.
No. Right, but Medicare is not working for a lot of people, right? I know older people that they still pay out of pocket for a DPC because they can't find a primary care doctor. They go to cash pay surgery centers and they pay out of pocket for their basic surgery because they can't find a surgeon. And that's only going to get worse for Medicare beneficiaries as we go on. And eventually, that's a powerful voting group. They're going to say, why are we paying all this money into Medicare when it's not working for us?
I think
think
if you want a success metric, you want to find something tangible that a lot of physicians can align around. And let's be very honest, we are pretty like-minded, but there are an equal number of people who have 180-degree perspectives when it comes to things like Medicare and healthcare and whatnot. I still think you can capture a good chunk of those people and align them conceptually with something as simple like, hey, you can own a hospital now. You actually have some skin in the game. You actually have some say in configuring how the care is delivered and how things are operated because your interests are tied to the facility directly. I know there are a lot of people who probably wouldn't agree with us politically, economically, for 75% of things where that message would at least resonate. I think it's low-hanging fruit in terms of getting people to align around it. It's something you could actively sell. It's a simple message, and it's a great thing from which to work from. But to Anisha's point, man, they've overregulated everything. It's a big bureaucracy. It's a giant morass. I'm not sure you can fix all that stuff. Maybe you have to build something different.
So I want to weigh in because we've just had a really good policy conversation right for the last 20 minutes. Should we weigh in on politics? Right? I'm interested because policy is one thing, politics is another. Does it backfire? And listen, as far as I'm concerned, everything that's backfired on me has been amazing for me. So I don't know if backfired is a bad thing, but I'd love your takes. Like, go ahead. Start with Dan.
I think that my choice has been, I'm political, but more towards healthcare related issues, personally, as a physician.
Yeah.
And me personally, why I've chosen to do that, I think my platform, I haven't been like openly like, oh, I love everything Trump's doing on all issues. I've really targeted just healthcare related issues. And I do agree with the things that his administration is doing on healthcare. So I'm vocal about it. I don't think that makes me necessarily political. I think that as a physician, I want to engage in the healthcare system. And for me, why I've chosen to try not to be super vocal about other areas of maybe social issues or whatnot. And I don't really go out and talk about those as much. I love the Doge stuff. I'm pretty happy, my taxes are going to get spent more efficiently. But outside of that, I also think in the exam room and with patients, look, I have Democrats, I have Republicans, I have all coming to my office. And sometimes they check my social media feed and they get to know me, right? And so if I'm out there talking about a certain issue that someone might read about and say, wow, I can't believe he's so extreme on this issue because they live on the other side of things, I think that does potentially impact the patient-physician relationship. So I'm pretty careful about all spectrums, and I just focus on healthcare issues personally.
Well, if we were all diving in at once and now everybody's waiting, who's next? All right, Anish.
Michael
all right,
Jordan,
let's go, Anish.
the greatest of all time, was asked. The guy was really a brilliant guy. What makes truly great basketball players. There's folks that could jump higher than you could, run faster than you could, but man, the guy was just so brilliant, right? So when he was asked about why he isn't taking more political stances and stuff, he had a very simple answer. He said, Republicans buy sneakers too. So he was like, why am I taking these stances here and there? Now it doesn't quite apply to healthcare in some regards, but in some ways it really does, because especially the way how polarized things are, you cannot, after 2015, after Trump came on stage, you just cannot, in many parts of the United States, wear your political sleeve and be out with your politics. You can't have these civil discussions about conservative versus Republicans. It is, for one reason or the other, the politics has taken on an extremely tenor at this point. Maybe it existed like this before. I didn't think it did. I remember having these massive arguments in the middle of the CCU with my fellowship director who disagreed with me politically, and it was fine. At the end of the day, I love the guy. He's great. And go home and have dinner with at some point later on in the week. But I think things have really changed. So I think it's a mistake for physicians to be frankly political, especially on social issues. I think it really damages your ability to have a relationship with your patients who are on the other side of the political sphere. Hopefully that changes at some point. But yeah, I think I learned the hard way that really does not make sense to do that. It was just the Overton window in terms of what you could say in terms of your politics really massively changed. And so I think that you have to be careful of that. I think what I've tried hard to do is stick to the policy parts of it, right? It's like there's nothing. We want the most access delivered at the best cost, right? And we want to take care of our folks that are the most vulnerable patients. I mean, those are all things that there's no physician that runs around saying, I only want to take care of the richest 0.1% of patients. We all feel that as citizens and as physicians that we want to do a lot of things to get healthcare accessible to as many people as possible. And I think the tack and the way to come at it is to be objective and not appear to be necessarily in one political tribe or the other. Because if you start talking about social things politically, then I think, the message is lost and it's like, oh, okay, you're just this tribal guy that's only going to say X, Y, and Z. And that's partly why it's going to be important for us as physicians to look at what mistakes the current administration makes, what things we don't want them to do, and be honest about it. Otherwise, you're just yelling at each other from opposite sides. But the hard part, the really hard part about this, though, of course, is that it's very hard not to be political because the government has introduced itself so much into everyday life, right? I mean, how is it? So if you want, so I think the better approach, and this is, of course, political just saying that, the better approach is for government to have less of a role in your day-to-day life. Like, why does government have these special privileges for Harvard and different things for whatever? So
Absolutely.
I think, and as much as that's a political statement that, hey, you want smaller government, that I think will allow you to live next to your neighbor who's of different politics in a much easier way than if government is doing everything for you, right? Then these decisions that government is making is like, oh my God, it's like affecting my life in this massive way. We really have to make work if we want to be more polite with each other and go back to a world where we could have discussions and not be at each other's throats. So I think we want a smaller government.
If you were advising your friends on how to get onto social media, would you give them the same advice? Would you say, hey, let's really stick to healthcare policy? I think it's a good idea. Is that the overwhelming advice?
I mean, if you're a practicing physician, if you're a practicing physician, absolutely. I think you got to be really, really careful about the social political stances you want to take.
I think if you take political stances in today's social media environment and in the last 10 years, Anish and I were both canceled at some point. We experienced it. And Dutch, you probably had people say some not so nice things about your politics. Like, you just got to be aware of, you're going to get attacked by the other side, whether you're on one side or the other. And so actually, if a friend was asking me, should I be political? I would, if it was someone like, and you couldn't handle it, I'd be like, you're probably going to get attacked and you may get canceled. It may affect your employment. You better be ready are you ready for that? I think for me, I also choose not to be political as a bandwidth issue too. I don't want to deal with the crazy attacks. Like when I actually got reposted by Elon Musk, I was nervous. Actually, I was excited. And then I was like, oh my God, wait a minute. Like what's exposure from this? And I thought about that too. But thankfully, my original post was less political and more about policy, just like Anish had said. And it was very respectful, I think, I addressed him as President Obama. And I was just discussing my heartfelt regret for voting for him because of what resulted to the physician community. And so I think it can be done. You could still get your policy points across without being too political. It's just like, if you're going to be political, just get ready to get hammered by the other side.
That's a good point, is focus on policy. And for example, when the residents and med students come rotate with me at San Francisco General, they're going to exit knowing how the treatment algorithms for thoracolumbar burst fractures, and they're going to know the in and outs and nuances of Medicaid and Medicaid policy. And then if we want to have a discussion like, what do the Medicaid cuts mean practically, then we can talk about it and we can not get emotional political. We can say, okay, what about state directed payments? What about provider taxes? What about the dual discounts between 340B and MDRP? I mean, there's so much nuance in there that if you really get down and have just a nuts and bolts conversation about what does the policy mean, what are the finances of Medicaid, what does 340B mean, then you can really sidestep the whole political issue and say, all right, what would you actually like a functioning Medicaid program to look like? And how can we get from here to there? And what are the most fiscally responsible pathways? And they may still disagree and think that I'm a terrible person at the end of the day, but at least it's because we've had a nuanced policy talk, and hopefully I've educated them on how these things actually function.
Dr. Dixit?
I'll tell you, I can learn something from Robert Malone. I can learn something from Peter Hotez. I don't have to agree with either one of them on most things. And I think as a physician, at the end of the day, I would hope our default would be having some sort of empiric scientific methodology We're all going to have opinions. There's a fine line between advocacy and activism. Maybe I blur that a little bit. I'm very outspoken, Dutch. You know that, you guys know that. But at the end of the
You're
day,
outspoken.
you want people to trust you. The minute we lose
Yes.
our trust, the minute we lose our ability, what I didn't like that happened during COVID is there were a lot of doctors who were talking down to their patients and talking down to other people because we were the experts. I'm the expert. You should listen to me. I'm like, how many times have you had a conversation with a patient and said, you need to have this surgery because I'm the expert? That will never work. It's a trust building exercise. We start to lose trust if we start getting too far off into the weeds. I think you should be allowed to have an opinion. I didn't vote for Obama. I was against the Affordable Care Act way back when. I gave a talk on the steps of the Denver Capitol expressing my resistance to it. And when I practiced in Denver, I had 2 patients who saw that video who actually made a comment to me about that was like negative or critical. And both those patients, when I had a 5-minute conversation with them and said, you know what, I actually agree with what you're saying. It was a civil conversation. Like the rest were like, oh man, you were spot on. But it's like, we have to be able to, they have to trust us. And if you're going to get politically involved, just remember you're a doctor, and I think that's sacrosanct. It's just how do you engage that trust? But I mean, we still need to be able to listen to each other. And that's something I think we've lost in the past few years because it's become so tribal. That's unfortunate.
Look, I have one more question because I feel like I could talk to you guys for hours. I remember Anish invited me to this thing on X Spaces, and I told my wife, I go, oh yeah, it's gonna be like an hour. And we were on with, oh, I don't remember his name, but the guy that said something about doctors get paid too much. He was blabbing on about it, but he's a very famous
Berenson,
COVID
yeah.
guy.
Yeah.
Yeah, Berenson. And I told her 1 hour, and like 2.5 hours in, she's texting me like, where are you? What are you doing? And I was in some parking lot outside the office trying to go insane. So, but I think that the audience is going to love these things. Look, I mean, I'll probably cut this little piece out, but look, you guys are highly impactful. So the question that I want to leave you with is I want to encourage other physicians to do what you guys have taken a chance on doing, which is like, I try to stick to healthcare stuff on social media. I know I'm guilty of posting a good cigar every once in a while, right? And the docs like send me tweets and text messages, you know, cigar smoking, blah, blah, blah. I don't pay attention to what any of them say. But the point is, I think what you're doing is you're making an impact. And if someone said, hey, is there a return on this? I think it's called goodwill. I think people read all of your posts that you guys do every single day, and they go, you know what? I can make a difference. I am burnout. I am tired. I am fighting this monolith. But I think, look, the 4 of you give them so much hope. So I'd love to hear what you think people who are considering speaking out. Look, there's 1,056,000 licensed physicians in the United States. I'm trying to make it one of our goals, right? To get them to speak out more. Like, I want to hear from them. And if they have differing views than me, I don't care. Like, have your differing view. But I think people want to hear from people in the public, want to be taught about healthcare. And I think you're the right people to teach them. So I'd love to hear what you'd say. We'll start with Dan.
I think that social media is a very powerful tool. And I think that any powerful tool, it's a double-edged sword at the end of the day.
Yep.
And I think that I've experienced some of the positives of social media and some of the power that you can have in terms of getting your good ideas across, maybe impacting some change. But there's also some real negatives. And I used to give a talk, kind of like intro to social media for physicians, like 8 years ago, 7 years ago.
Oh, you did?
Back in the day.
That's cool.
You know, and this was at the
Yeah.
medical society level, locally, and the talk was kind of like technical, right? Like how to start an Instagram account, how to start, and why social media is important to get your brand across. But I also left in a few slides about exposure to social media. And this might be counter to the point of this question, which is like to encourage physicians, but it actually gets back to the root of why social media is also important, is that I think that a common thread amongst 3 out of the 4 physicians here is that 3 out of 4 of us can be unfiltered on social media because we're independent. For the most part, we're private practice. I don't work for anyone. I'm not really. And unfortunately, the issue, you look at Elizabeth Potter, who have blown up. Bill Ackman has been able to engage her, and she's been able to speak out about insurer abuses with denial of care. I believe she's private practice, right, when it comes down to it. And I think what you would see is that if physicians could actually all speak their mind freely on social media, you would have an eruption of ideas, and you would see the same points that the four of us are making. Everyone would be saying it in unison. Okay, people are actually afraid to even now that likes are actually anonymous, probably not as much, but people are definitely afraid to repost some of these ideas as well.
Oh, yeah.
Afraid that they are going to upset their corporate medicine employers, right? And so I think my point is like, look, I think there's a lot of people out there who want to say and want to get on social media and say it, but they just are not because of their current situation, which the majority of physicians are in at this point. So I guess my question to the group is, how do we get around that, right? Because look, I can't be the voice of millions of physicians. I voice my own opinions. I think it's important to voice my own opinions and hopefully get them into the atmosphere. But the question I have for you guys, and I'm still thinking about it, is how do we hear and how do we restore free speech back to physicians? The tweet that I have pinned on my account, okay, if you look at my account, I have one tweet pinned. It's not the Elon Musk account tweet. It says this. It says, if you truly want a free society, you need independent physicians. That's it. If you want a free society, because physicians are going to impact a big segment, that healthcare is a big part of our society and how it runs. And you saw that during COVID when we were responding as a country to a big healthcare crisis, and healthcare was weaponized to limit freedoms in this country. If you had more independent physicians, you might direct impact, and the control that was exerted on the population may have been blunted, in my opinion. And how do we hear? How do we get the free speech? How do we
It's a
restore
very
free
tall order
speech?
because you'd have to end medical licensing.
That's true.
It'd be great.
Yeah.
Is if you can take physicians lounge. Listen, this is where the best conversations happen between doctors. Doctors speak their minds when they're in the doctor's lounge, and they tell you exactly what they think. Imagine it's fun one day every year where between the hours of 12 and 2, you set up a podcast microphone in every doctor's lounge.
Whatever
and
you
said,
wanted.
kind of like peer review. You're indemnified for whatever.
Dan, but guys,
and
we
let
are
your
in
freak
such a
fly.
heavily regulated industry. It's like they can get you in so many different ways. Hospital privileges, they can get you with the medical board. We have one of our colleagues, Bowden, Dr. Bowden, she's an ENT physician in Texas. It's like everyone, there's 7 guns to every one individual.
She's really fantastic.
Yeah, I mean, she's
fantastic.
courageous and said a lot of things that were completely against the mainstream. And obviously, got as an ENT physician, was running around trying to treat COVID with a variety of cocktail of things. And again, you don't have to agree with how she's treating things or whatever, but at least to watch what she has been put through. The Texas Medical Board came after her. And is still coming after her. And there's a possibility she's sanctioned. There's a possibility she loses her license. There's a possibility she can't practice as a licensed physician. I don't know how. I think, yeah. So I've thought for a long time that the only way to really, we want free speech, and it dovetails nicely with this whole business about NPs, PAs and stuff. You know what? Make it a free for all. Like, forget about the MD license. If you want it, the tests are all voluntary. If you want to take your board test, go ahead and take it. If you don't want to take it, don't take it. But let everyone put out a shingle and be like, all right, I will be craniotomy at 2 a.m. And I am pretty sure they're going to call Anthony DiGiorgio and not some guy who slept at a Holiday Inn the night before. But again, so I don't know how else to. I will say, I completely agree with you that there's certainly there is much more freedom if you are an independent physician versus being an employed physician. But man, there's still limits that you're going to butt up against that are really unfortunate. You really have to be very careful, because if you say some things that are out of the mainstream. I wrote this long thing about a cardiologist in University of Pittsburgh, director of the fellowship, academic, wrote a white paper,
Asian guy.
Yeah, Norman Wong, accepted by the AHA journal. And there's some mob that came after him because he said he disagreed with affirmative action. He said that affirmative action as it stands is illegal, is unconstitutional. He was proven right by the Supreme Court. And that guy, Norman Wong, was demoted from being EP Fellowship Director, was at least for some period of time, not allowed to deal with trainees because of harm that he would cause them. It's just ridiculous. And that's for publishing a peer-reviewed paper. So, yeah, it is certainly, I think the Overton window has been cracked open a little bit with the current administration in terms of what can be said, what can't be said. But yeah, I'm all for what Dan's saying. It'd be great to restore free speech to physicians, because right now we really do not have the ability to speak our minds in any real way, I think.
Yeah, as the employed
Look.
physician to my institution, they actually have great free speech policies. And I think we've seen that exhibited from other physicians at my institution. I think they've been some very vocal ones on both sides of the aisle on Twitter. And so it's nice. I think it is, if we're talking about giving advice to other physicians, is check with your institution. If you're employed, make sure you know what you can and can't say on social media. Do you need to put a disclaimer, et cetera, et cetera? It's nice to know what your protections are and make sure if they do have something written down, that you're standing on the
and
right
it must
side
be
of it.
said that if you take a large amount of risk, right, like Jay Bhattacharya did, right? Jay Bhattacharya was just crushed at Stanford. They came after him, as well as Scott Atlas. They censured him. Marty McCreary faced a ton of things. Vinay Prasad, geez, oh man, that guy has a mob that's after him every week for what he's saying, right? But look where they all are now. So I guess there's two sides to that, to all that. So Anthony, you should have been, who knows, you could have been FDA head if you had just been more.
Only I was more articulate.
Hey, so we've got one brain surgeon, two spine surgeons, and one guy with a great heart.